Hi everyone. Many patients often ask why my kidney is swollen but I have no major symptoms. Should I worry? I always tell them yes, you should, because that swelling may be due to a condition we call it in the medical term Pelviureteric Junction obstruction or PUJ obstructions, which silently impairs your kidney drainage and functions. Today, I will try to explain what this condition means and how laparoscopic or robotic pyeloplasty offers a definitive, minimally invasive solutions with outstanding scientific outcomes. Now, PUJ obstruction refers to a narrowing at the junction of the renal pelvis where the pipe originate and the ureter. It results in the impaired urinary drainage, leading to the swelling or the hydronephrosis in the kidney, which progressively destroy our kidney. According to the Indian Journal of Urology 2023 data, PUJ obstructions is increasingly being diagnosed in adults, often which is secondary to crossing vessels or maybe fibrotic changes or poorly developed muscular segment in the urine pipe. This is not just an anatomical abnormality, it is a functional pathology. Even if the patient feels minimal pain, persistent obstruction leads to cortical thinning, infection, stone formations, and ultimately irreversible renal impairment. Patients often delay treatment due to lack of symptoms, but the absence of pain does not mean absence of damage. This was published in European Urology Review 2022, in which there was a cohort of about 487 patients with moderate to severe PUJ obstructions. Over 60% of them had no significant functional deterioration despite being asymptomatic. Now, the key indicator for intervention is not pain. It is a combination of functional studies, that is renal scan, and the degree of hydronephrosis or the swelling and the presence of infection or stone. If the differential renal functions drop below 40%, corrective surgeries become necessary. Now, laparoscopic pyeloplasty is a minimally invasive surgical technique wherein the obstructed segment is removed and we create a new widely calibrated junctions using fine suturing. In robotic pyeloplasty, surgeons operate the same way through a console using multi-articulating instruments and a high-definition 3D vision, enhancing precision, especially in cases where the crossing vessels or redo surgery is required. Now, if we talk about the scientific outcomes, which was very recently published in one of the meta-analysis in Journal of Endourology, the overall success rate of these surgeries are close to 99%. Intraoperative blood loss is 70% less than the open surgery. Hospital stay is typically 1 to 3 days. Cosmetic and the functional outcome is more than 90%. Now, this procedure has become a gold standard, especially for young adults and children, where long-term preservation of the renal function and the cosmesis matter. Now, let's talk about some of the queries from our viewer. Can we just put in DJ stent to bypass the blockage? This was asked by one of my patients. Now, the answer to this is a common temporary solution, not a cure. A stent offers short-term drainage but does not address the structural problem. So the medication cannot relieve anatomical blockage. So intermittent stenting may even lead to increased scarring and the worsening of the obstruction if used long-term without definitive repair. Now, the key benefit of the robotic or the minimally invasive laparoscopic pyeloplasty is there is a permanent anatomical correction. No large incisions or muscle cutting is required. Lower complication rate overall as compared to the open surgery, applicable for both the primary as well as the redo cases. If your renal scan shows decreased function or imaging shows there is a swelling which is moderate to severe, do not wait for the symptoms to appear. The window of the intervention is very narrow. Timely pyeloplasty can restore the drainage and protect your kidney in a long term. Now, I will just quote some of the few indications for the surgery. If there is a renal function which is less than 40%, recurrent UTI or a stone in the affected kidney, flank pain with imaging evidence of any functional or anatomical obstruction, anatomical crossing vessels which we generally confirm with the CT or the MR study. In expert hand, laparoscopic and the robotic pyeloplasty offers a highly effective, safe and the scar minimizing alternative to the open surgery with excellent patient satisfactions and the outcome. So whenever we are having these kind of patients who have been diagnosed with obstruction in the kidney, we generally counsel them regarding different options for the surgery. So if you have any queries, you can generally send me comment me in the comment sections and generally ask me a lot of important issues or queries whatsoever in this segment. Thank you.